Okay, hello everybody, and welcome to Rare Disease Day, a very important day in the Sciences calendar. And I'm absolutely delighted that we were joined just before Christmas by Ray Hummel, who's joined us as Vice President, Rare and Orphan Disease Strategy. Ray's based out in the US, in North Carolina, to be more specific, and he's going to be our Sciences ambassador out in the US. He's really going to help us build our Sciences brand and help us work with many customers to help them bring their products to Europe. So a really exciting development in the Sciences journey. Ray has not only got 20 years experience in rare disease, but he's also got 30 years experience in industry. So a huge addition to the team. So I'm now delighted to hand over to our new colleague, Ray Hummel.
I'm honored to participate in this. I think it's a significant event, and it resonates deeply with me both professionally as well as personally. I'm a parent of two children that live with facioscapulohumeral muscular dystrophy, also known as FSHD, because it's kind of hard to say that fast several times in a row. It's a rare form of muscular dystrophy, and that's why this day holds a special meaning to me. For those of you who are not aware, Rare Disease Day is an annual event held on the last day of February to raise awareness about rare diseases, and it's also to advocate for equitable healthcare, diagnosis, and treatment of everybody who's affected. It was first launched in 2008 by EURODIS, the European Rare Disease Organization, and the Council of National Alliances. The date February 29th was chosen because it's the rarest day of the year, but in the non-leap years, it's held on February 28th. It was initially celebrated in 18 European countries, but it's grown and it's really expanded globally. By its second year, it included participation from countries like the US, Australia, and China. Today involves over 100 countries and aims to unite parents, patients, families, healthcare professionals, and policymakers supporting an estimated 300 million people in the world living with rare diseases. So individually, they're rare, but together, it's a very large number. I'm thrilled today to have my daughter Meredith with us here today. Her 8-year journey with me on Rare Disease Day and her unwavering resilience continues to inspire me and her whole family. Meredith will also share her experience living with FSHD later in this program. Our event will kind of proceed as follows. I'll be handing it over to our Chief Clinical Officer, Jonathan Asbridge. He'll be providing a couple of remarks and talking kind of with his role for the Rare Disease Day in context of Rare Disease Day. And then we're going to turn it over to Meredith. And then Jonathan will kind of moderate a panel between kind of Meredith and himself. And they'll be asking questions and stuff that we thought would be insightful for colleagues to learn about on this day. And then we're going to finally turn it back over to Richard, who will provide some of the closing remarks. So I'm deeply grateful for the leadership team at Sciensus here for their dedication to Rare Disease Day. And I appreciate their commitment. I think it's truly commendable, and it's very personally and deeply appreciated. Now I'm going to hand it over to Jonathan to provide some remarks about his role before we turn it over to Meredith.
It's a tremendous privilege for me to be able to speak about not just the role that I hold, but also the work that we do at Sciensus. I've been the Chief Clinical Officer at Sciensus for just over 10 years. I've been with the organization for 11 years. And, we've seen the way in which we're able to provide support and service to our patients, the people who use our services, grow over that period of time. And I've got some numbers here, which I think maybe you might find quite interesting. Rare diseases are classified in all sorts of different ways, but there is a group of people who have rare diseases who are referred to as people with ultra rare disease, and those would be people where the incidence of the disease is actually only less than 1 in 50,000 people. It's an awful lot of people, and only one person, possibly less than that, with this disease. And over the last 5 years, we've treated 445 patients with ultra rare diseases. And since those 5 years have passed, patients with rare diseases, who are normally people who have incidence of the disease between 1 and 25,000 and 1 in 2,000. We've been treating and taking referrals for over 50,000 patients. So we have a lot of experience in managing patients with rare disease, supporting them, not just in the UK, but in Switzerland, and also now further in Europe, as we've been growing the services that we provide for our patients and people who use the services across Europe as well. And this is a tremendous thing for us to do. And over the years, we've built relationships with referring consultants and physicians in over 300 referral centres across Europe, where we actually treat patients who have been referred to us from those centres. And that's a tremendous development from the first young person that we had the privilege of treating 30 years ago in Bristol, a young person who was in school and had to go to hospital every other week to have his treatment. And one of the nurses in the treatment unit said, "Why can't we treat this young person at home?" And actually went home and treated the patient. And that person was one of the founders of Healthcare at Home, as we were called then, and Sciensus now. So we have a real heritage in providing services and support for people with rare diseases. And everybody in our organization is focused on providing the best care, the most reliable care, the most consistent and professional care, and the most safe care for our patients. Everybody, the team that are working in the dispensary in the warehouse, who manage these drugs, which are massively expensive and very rare, and need to be curated right the way through to the patients and to the nurses. To our pharmacy teams, to our patient support teams, our patient services teams, and also clearly our clinical teams who treat our patients. And we interact with our patients at least 16 times in a year, some a lot more. Patients will have nurse visits every few weeks and have a delivery of their medicine even more. So we have a lot of experience. We really believe it's a privilege in the way in which we're able to support our patients and the way in which we're able to work with our referral centres to make sure that our patients are able to get the best out of their medicines, but also live their lives totally without any restrictions that are avoidable, because we make sure that we avoid those restrictions, whether it's supporting people in work or whether it's to support young people to be at school or college. And we treat patients, as you know, across the UK and in Europe. So if one of our patients has to move to go to college, which is increasingly being the case, then we have teams locally to the universities where we're able to go and treat those patients as well. And I'd remind you that 22% of our patients are between the ages of just born to 18 years of age. And our teams get to know the young people right from when they're babies right the way up to graduating from college and all of those things. So it's a tremendous thing for us to be able to celebrate Rare Disease Day today, but also to share with everybody what it is that we do as an organisation. And I too want to join Richard in welcoming Ray to our organisation. Thank you very much, Ray.
Allow me to briefly further introduce myself for those who may not know me. With over 30 years in the biopharmaceutical and healthcare industries, my journey began as a veterinarian. I quickly transitioned to the contract research organization sector, though, where I honed my skills in evaluating pharmaceutical products. The main reason I did this was for capital investment, and I gained extensive knowledge in drug development and commercialization. My professional trajectory, though, took a profound turn when my daughter was diagnosed with FSHD. This personal experience merged with my professional background, and it offers me kind of a unique dual perspective, really, as a caregiver as well as a biopharmaceutical executive. I'm honored to be part of the Sciensus team, where I have the opportunity to assist the American companies, as we talked about before, as Richard mentioned. This role really, by working with American sponsors of rare diseases who wish to bring their products and innovations to the EU market, allows me to bridge a gap between patient needs and industry capabilities. And it's a mission that's deeply personal and professionally fulfilling for me. My heartfelt thanks go to all my colleagues who have made this event possible, some of those who are behind the screens here today, and some of those who are not recognized. But I do appreciate your dedication to the rare disease community. It inspires me. Next, it's my great honor to introduce my daughter, Meredith, who will join us in just a second here to celebrate. This will be our 9th Rare Disease Day together. Meredith's journey with FSHD, in my opinion, has been one of resilience, advocacy, and inspiration. She was diagnosed in 2004 after facing challenges like difficulty lifting her arms and keeping up with her peers in dance classes. Meredith has since become a powerful voice for the rare disease community, and she's done podcasts, helped me written a couple books, and even published some papers. She served for over half a decade as the founder and director of the North Carolina chapter of the FSHD Society, which we co-founded in 2018 together. She's worked as a communication assistant for Disability Rights North Carolina, and she now works for Youth League North Carolina. And that's a program designed to empower individuals and disabilities that are either age 30 or younger by providing peer support, leadership training, and essential skills to help them reach their full potential. Her dedication to raising awareness and supporting others living with rare diseases and disabilities is remarkable to me. Today, Meredith will share her personal experience of living with FSHD, offering us some valuable insights into the daily realities and triumphs of navigating life with a rare disease. Please join me in welcoming Meredith to the stage.
My name is Meredith, and I'm 32 years old. As my dad mentioned, my rare form of muscular dystrophy is called facioscapulohumeral dystrophy, which is fun to say with someone who has facial weakness. I also have epilepsy, anxiety, and CPTSD, which is chronic PTSD. And I was diagnosed with muscular dystrophy at 12 years old. And I began working in the rare disease space with my dad, who actually started researching and talking about muscular dystrophy more than I did. I had about 10 years there where I was very uncomfortable talking about my disability. I actually wouldn't say FSHD. I couldn't do it without crying, and I felt very alone. So I decided to start working with my dad. Like he mentioned, we worked on a couple books together. I had a chapter on patient advocacy. We published some papers and formed the North Carolina State FSHD chapter. And as I began to open up more and learn about disabilities, I became more interested in disability law and advocacy. So in 2017, I started working in the disability community, excuse me. And the job that I started in was Disability Rights North Carolina, which is a nonprofit for people with disabilities. We actually have one in the US for every state. They're called protection and advocacy agencies. So there I got really involved in disability law. I was doing intake, so I heard a lot of stories from people with disabilities about violations in healthcare, employment, school accommodations, housing, all the things that you can think of, and more. And it really inspired me to keep working in the disability community and hearing these people's stories. After that, sorry. Now I work at an organization called Youth Lead. We work with the youth and young adults from the ages of 15 to 30. And our main program is a summer camp. And the three things that we really focus on is leadership, advocacy, self-advocacy, systemic advocacy, and advocacy in healthcare, and transitions, transitioning from college to employment, high school to college, and especially transitions from people with disabilities out of their home into the community. We also talk about the employment, housing, goal setting, disability history, etc. And we really believe in independent living and prevent people with disabilities from going into institutions. It actually costs less to get services in the home, but the government gets more money from people with disabilities being in hospitals and institutions. So we really want these people with disabilities to live the lives that they want to live, and follow up with them and make sure that they're doing okay, providing some peer support. And I think the main thing, and I personally love about this job, is the connections and the friends that you make, and the lives that we touch. I want people with disabilities to gain confidence in themselves, especially having a rare disease. It's tough finding friends who also have that rare disease, or finding support groups sometimes. And also, lastly, gaining empathy for others when they learn about other disabilities. People with disabilities and rare diseases have a very unique point of view. We're always learning to adapt. So I think we can really bring a lot to the space, the healthcare space, in addition to many other spaces. Personally, a little bit about my journey. I was very passionate about dance when I was younger. My dream job was to be a professional ballerina. I had to give that up when I was about 16, and I noticed that I just wasn't keeping up with my dance classes. I couldn't really get off the floor, so that was really rough. And one of the things about rare diseases is grieving for the life that you could have had and thinking about all those things that you're very passionate about, and having to give that up, or knowing that you'll have to give that up in the future. I failed out of university because I didn't ask for accommodations. I didn't even want to look into them because I felt so lonely and I felt really ashamed. I've always had kind of a weird walk, and I've been very skinny, so I got a lot of looks when I went out as well. It just kind of it just felt very vulnerable. Um, and later with Jonathan, we'll touch on some more things like healthcare and trauma-informed care, etc. Thank you.
I think we're going to turn it over to back over to Jonathan and Meredith to come on, and they will. Jonathan will ask Meredith some questions that we think are going to be insightful for those of you who are listening, and hopefully enjoyable.
Thank you as well, Meredith. It's really inspirational listening to you speak, and obviously we've spoken before, and I just wanted to start off with this conversation to say that clearly we I felt talking to you is like I like talking to a number of the particularly the young people that we serve, and at the thing that I was interested in talking to you about is how did your journey to coming to a diagnosis start? Because obviously one of the things that we find when I talk to families and talk to the parents and to the young people themselves when they're diagnosed as young people is, in many ways, it's such a massive relief to get a diagnosis because quite often they've been through many years being passed from clinical team to clinical team who scratch their heads and say, well, we don't really know what this is. All we can tell you is what it isn't. And I wondered if you had any kind of similar experiences that you wanted to share, because it does impact on the things that you described, which is going through that experience then impacts on where you need to be, where you are when we meet you as clinical teams. Is really where are you, and how can your experience help us to get better at meeting people where they are when we first meet them?
In middle school, which is about 10 years old, I started noticing my scapular wings moving around and kind of popping out when I moved my arms around, and it was harder for me to get off the floor. So I think at that point I wasn't really looking for a diagnosis. Actually, I just kind of wanted to hide and pretend that everything was okay. So it did feel a little bit of relief when I finally got the diagnosis. I did get the wrong diagnosis at first. But after I did get my diagnosis, there wasn't quite as much known about FSHD. And so I really walked away with kind of little knowledge on it. One thing that really stood out to me is that the doctor said that this was going to affect your muscles. So me knowing that the heart is a muscle, I actually thought I was going to die early for a couple of years. And I really, that was just really traumatic for me. Because we just didn't know a lot about it. So until I kind of researched on my own, and there are other conditions that can be terminal, but not that one. So after after I realized that, it was still very hard, but yes.
Yeah, no, that really makes a tremendous amount. That really makes a tremendous amount of sense. And so, as you live your life now, I mean, clearly you're a professional person. You've got a career. You're such a role model, I think, for any young person who might have a rare disease. what do you think helped you to be able to, you know, face into the issues that you had to face into? And I know you're 32 years of age, and that journey has been a long journey, really. I mean, in terms of what you've had, what would you say has really helped you to get to where you're getting, where you're actually giving back more than you've received by the look of it anyway?
A couple of things. One is you really have to change your perspective. I mentioned earlier grieving for, a life that you can't have, that you pictured for so many years or that you're really passionate about. Um, you need to change your perspective, excuse me, on focusing on the present and being happy where you are, and turning that fear and anxiety into helping other people. Another thing is healthcare teams, social workers, healthcare teams. I can remember specific nurses and EMTs, ambulances. Remember certain people specifically, very vividly what they look like. And one woman, I have to get my blood drawn a lot, and I've kind of developed a needle phobia. And I was in the blood lab. I remember I was saying that I don't like needles. I'm sorry if I pass out. It's happened before. Um, and the woman drawing my blood told me to think about something happy. So I was like, okay, I love puppies. I'll think about that. The next day I came back to the blood lab, there was another nurse there who was there last time, didn't draw my blood, but she was the one who was going to help me that time. She pulled up her phone and went to TikTok and said that she saw my name coming up on the screen for later. So she downloaded a bunch of TikToks of puppy videos. And so that was just so sweet, and it made such a difference to me wanting to come back. The fact that people remembered me. One of the doctors there that I've seen a couple of times said, "Oh, you got a new wheelchair. That's cool." So healthcare team is very important. Um, and you wanting to come back and receiving treatment is not super common. So having a patient that wants to come back and see you and is kind of comfortable in that space, knowing that they're going to be helped the best way they can, and that they're going to be respected by their doctors and their nurses, etc., is really important. Um, and without that, I've had issues in the past too where I don't want to come. I don't want to come see anyone, even though a yearly physical would be great because then you've got to track your progression. And I didn't go for a while because I just hated it and I was scared of it. And now I'm kind of like, okay, this is a good thing. And the team here is really great. So it's not a super anxiety producing experience anymore.
Mm, mm. I think what you were saying about needle phobia really resonated. I'm sure it will with the clinical teams across our organisation, because we walk the journey with our young people and our patients, and we see that, and also people have different phases of how they are and how they feel. Everybody feels very different, and of course, our nurses go into the patient's home. We're on their territory. We're on their territory, which I think is quite positive, because we negotiate with the people we serve what they want and how what they prefer. But those supportive gestures are so important for all of us when we're receiving any kind of clinical care, that makes such a lot of sense. And it really leads me on to the questions we talked about before, which is the whole concept of trauma-informed care, and something which we're very alive to here in terms of our real striving to be as person-centered as possible, not just patient. We're not just treating patients, we're treating people and supporting people to live their lives. Your experiences of trauma-informed care also links, because I know you never put a negative without a positive, so also links with the healing-oriented support. Could tell me a little bit about how you've managed that journey as well?
Yeah. So a definition of trauma-informed care that I really like is that it acknowledges that healthcare organizations and care teams need to have a complete picture of a patient's life situation in order to provide effective healthcare services with a healing orientation. And adopting these practices can improve patient engagement, treatment adherence. So like going back to the doctor, staying with your pills because, if you have a side effect, you're comfortable telling that to your doctor. Um, and also provider and staff wellness, and reducing avoidable care and excess costs. It's more, it's less expensive to have a patient be taken care in their home than it is going to a hospital or institution. And trauma-informed care is important for all ages, but especially in children and those with cognitive and intellectual disabilities, it might be tougher to kind of work on those triggers and how to deal with them. And then the added trauma and anxiety for underprivileged groups like people of color, rural residents who may have trouble finding resources or accessing the internet, the LGBTQ community, and taking account the violence against women, and that, hey, a woman might be more comfortable with a woman doctor. And that's something that you should prioritize with them. And just PTSD from other stuff that come up. Disability is not the only thing that brings trauma. So your role as a caregiver really has a significant impact on those people that you're working with, especially when you're considering their trauma and realizing that medical trauma is a huge thing as well. Besides losing friends and family because of your condition and you can't go out as much, it's hard for people to find accessible stuff, so they just think it's easier to maybe leave you behind. Gaslighting is a huge thing in the medical community. I know one of my specialists had me started on a medicine, procedures, and I started having just very gruesome and violent nightmares the day I started taking them. And my doctor said, well, that's not a side effect of that. So I said, okay. So I kept taking it. I came back again. I said, hey, I'm really having terrible nightmares with this. And eventually I think I went on a different medication, but that was a little bit disturbing, made me feel a little uncomfortable. The anxiety and fear of the unknown, at appointments and new doctors, maybe, vivid flashbacks or PTSD from surgeries, even the smell of a hospital can kind of be triggering to someone. Imposter syndrome, thinking that you're overreacting and you're not as sick as you think you are, being scared to ask for help. And invasive and personal questions. Unfortunately, you're going to have to explain your disease over and over again to people. It's just how it is, and it's that's also hard, and it can be really, really exhausting.
Have you, during your time in accessing services, has there been any particular arrangement that really worked well? I mean, I'd like to come on. Obviously, you're 32 years of age, and you're a complete youngster, as far as I'm concerned. But we know that there are differences and challenges when young people move from mainly children's provided focused services onto more adult services, and we experience that on a regular basis. But in terms of, as you've been going through your journey, is there any particular either arrangement or even individual who you may have had more contact with where you felt there was somebody on your side? I mean, because did that ever, have you ever encountered that where you would note that or remark on it and recommend that kind of approach?
Yeah. Actually, my spine specialist is from the UK, and he, I think he's one of my favorite specialists. He doesn't look at my parents when he's talking about me. That's a really common thing, especially with people with speech impediments, is to look at the caregiver or the parent, or like instead of talking to the actual patient, or it's not, people with disabilities are human. You can talk to them like they're human. You don't need to bend down and, hey, buddy, how are you doing? When they're 40 years old, that's a little bit awkward. And so my spine specialist always, he'll sit in the chair that they have, and he'll, instead of sitting at the desk, he comes over next to you. Um, and it's just kind of casual, explain stuff in simple terms. I like big words, so personally, sometimes I really like hearing medical terms because I'll go look them up. Um, but just in plain terms, it always tells me, hey, you can always reach out. Don't be afraid to annoy me. Um, and gives me his email. And I brought him chocolates from Belgium for that because I was very kind. And he makes me and hopefully his other patients just feel very welcome and feel like there's someone definitely there, even if it's a quick question. He'll solve it. He responds to emails in like a day or two. So that's a great experience that I had with him.
That's tremendous to hear. And just moving on then to the transition that you would have experienced having when you were first sort of diagnosed, and then moving on to service. Did you notice a difference when you were with, I don't know whether you were with a team that you got to know very well and then had to move on to another team? What was that like for you, that transition from, I guess, young person to adult? I mean, it's tough enough without having access to services. When you have to access services and they change as well as you're changing.
I think my services definitely got better as I got older, and one, it's because I actually started to care about my health, and started going to services when I was like 22, 23. I avoided the pediatrician for muscular dystrophy like the plague. I really did not like like that person. Very no bedside manner. Very awkward, doesn't really look at you, and that made me really uncomfortable. So it was mostly because I was in denial at my diagnosis, honestly. Most of the reason I didn't like going to pediatrician, excuse me. But now I think I have a much better care team, um, who I feel very comfortable with reaching out, even if it's a random question about physical therapy. Um, no problem reaching out. I have everyone's email addresses, and they're pretty quick to respond and kind about it. Um, something. Well, Google is there. Well, I know, but I'd like to ask an expert. So yeah, that's I have a great care team now.
Yeah, I know. Yeah, and the work that you're doing, obviously, I touched on the work that you do with the young people and the youth leadership that you've been showing, a mentorship to them. And how did you start that off? I mean, that is just an incredible thing to have achieved. And I have to tell you that a lot of the people that we serve with rare disease, be assured we know what they want, right? It's because they're not slow in coming forward, and I think they would echo a lot of what. But it's still one thing to be hopefully, and we much prefer people to be a bit spiky on our service. Otherwise, people don't tell you what they want. How did you go about doing that? Because that's such a positive thing.
Yeah. So the summer program that we have is actually a national event. I think about 30 states also host this program. And North Carolina, the state I'm in, stopped holding the program. The organization that hosted it stopped hosting it. And my boss, who is I think 1 or 2 years younger than me, was like, that program was pretty life-changing. I'd like to start it up again. So a few years later, she actually started the organization to start hosting this program again. She's one of my heroes. She's so cool. And we had unfortunately COVID hit, so she had 2 years of virtual programs, but the last 3 years we've been doing it in person. And I loved the mission when I found her. I wish that I would have gone to that when I was younger. I just remembering how alone I felt, and I also didn't see anyone my age in a wheelchair until I was in my 20s. So being there and working the first time at the camp, I cried a couple of times because I had just never seen other young people who were in wheelchairs or had different disabilities. And I thought that was amazing to have all these people come together and become more confident in themselves. We have personal care assistants, and we don't actually let them take their own personal care assistants so that they can practice with these new care assistants in telling them what they need, and advocacy and knowing just about their rights in healthcare, and practicing their advocacy in healthcare. Because a lot of these people and social workers really care about them too, and they want to know without asking, "Hey, are you okay? Are you okay?" all the time. We want these people to say, "Hey, can you help me out with that?" Or, "Hey, I'm not really feeling comfortable with this." So that's one aspect of it that I really like. Um, but yeah, it's an amazing program, and it's definitely life changing. I've had several people that have emailed me. Um, Mom emailed me saying that for the last like 5 years, one of the young men that came to our program said he wasn't going to college. He was going to live at home forever. He actually signed up for college a couple weeks after the program, picked what he wanted to do, and now his younger brother is coming to the program because he had such a great experience. And Yeah, and his mom just said he's been more confident. He made a lot of friends there, was able to network with other people. Um, and so, yeah, I love the mission, and um, me and her are the only employees right now. So we're starting to, trying to reach out and network with other organizations. So hopefully, we'll become the official um, uh, youth organization for North Carolina. We do serve all counties, and all disabilities, rare disabilities, and in general.
Yeah, because I think it is, you talked about parents and family members. Of course, it's a whole team effort, isn't it?
Yeah,
When we're,
yeah,
we're supporting each other, there's a kind of success story when you're dealing with young people when the parents just say, "I don't know what's happened to them, but they're a complete,
yeah,
pain. They just want to do what they want, and
yeah,
that's success, isn't it? Great success.
yeah,
And I think the other thing I've really heard you say, and I've talked about it being a journey, but talking about maybe going through the life that you didn't expect to have but you got, and it is reminds me, it's like it is running a marathon. Like, this is not a sprint. No life is a sprint. All of our lives is a marathon. It's just that this is different. I'm really conscious of time, Meredith, and I know that we need to move on. But I know lots of people will probably have questions, and I think Ray and Richard will probably help us to understand how. But anybody who's watching this, I think you're happy to take questions from anybody, and I know that
yes, yeah,
there will
excellent.
be questions. I think you may have quite a few speaking engagements coming your way as well. But
That's
um,
okay.
I just wanted to thank you for having this conversation. I've learned so much, and I've really enjoyed being with you, and looking forward to continuing our work with rare diseases. I think it's been tremendous. Thank you very much.
So, with that, I'd like to thank everybody who has been with us on this journey today. Thank you, everyone who is celebrating Rare Disease Day and taking a moment to pause to think about others. Um, Next, I'd like to hand it over to Richard, who's going to kind of wrap us up and talk about some of the things we've heard and kind of next steps. So, Richard, I'll turn it over to you.
It's truly humbling and inspiring to listen to Meredith's story and her journey. And it reminds us of the importance of what we do every day and why we feel motivated to continue to try and deliver the best possible service and support to our patients.